Evelyn. I was in an emergency. I had a concern about the way I was feeling and I wanted to have my heart checked. And then 4 days later, I was indeed in the hospital with an event. It was a stent. They had a stent procedure. The most significant negative experience I had was in ICU. And I was just recovering from my anesthesia in a bed, of course. And what I noticed was there were so many pieces of equipment on my body. There was one that had like little suctions, and it was connected to my heart, and it was very comfortable. There was a lot to it, but it was very comfortable. On my right arm, there was a needle, and it's very, very comfortable. It went straight in and had 2 receptors in it. And then I had blood pressure equipment up on my upper arm. On my left arm, in this vein, there was a needle, also with a receptor. And I asked the nurse, what is all of this about? And she said, in case there is something that happens as in post-surgery, we have to be able to access immediately. And I said, but this one hurts. And I noticed that the needle was bent. And she said, I said, well, this one hurts. She said, well, I'm sorry, but I have to have access to it immediately. And she completely ignored the idea that I was hurting. Also, on my right arm, as I said, there was high blood pressure equipment. And she said she had to take my blood pressure once an hour. I said, well, it's so cumbersome. Could you maybe take it off and then put it back on? And she said, no. Well, within a very, very short time, this needle hurt me so badly that I took the tape off, pulled the needle out, and a lot of blood went everywhere. That got the nurse's attention. She said, where did all this blood come from? I said, I took that off. And she did not replace it. And literally ignored me. And I sat up and I said, I'm going home. And moved there was an obstacle there to keep patients in the bed. And I put my legs on over the side of the bed. And within a very, very few seconds, there were 3 women holding me down, and they tied me to the bed. Humiliated, disbelief. They're not listening to me. And one gets that attitude that the medical profession does not listen to the patient. They know it all. And I frankly believe that the pain in my elbow or in this vein could have been corrected within 1 minute, because it was simply because the needle was bent. And she just completely ignored me. And those nurses were so kind. They never left my side. If I had a question, they answered me. For example, I asked them if I could have an ice pack for my back. I got it. And they took my blood pressure every hour by putting the equipment on my arm, and I didn't have to put up with that inconvenience. But they were so, so good to me, and it was a wonderful way to end my experience there. Yes, I had discharge papers. May I say that I have no record of what was done in cardiology. I heard a voice say you had 3 stents, 2 of them at 50%, 1 of them at 99%, and that was all I know about what was actually done to my heart. I have nothing in writing. In ICU, 1.
Wow. And in the other wing?
And 10. This is rather humorous, but when I was in the other wing with the other ladies, I kept saying, I want to go home. I got to go home.